Hi.
Hi, Miss May. So no one else is home, so it's just me and my youngest. So he's going to be my patient. You say hi?
Hi.
Hi. Okay. So we'll pretend like we would do it any other time. Okay. So I would wash my hands. I would introduce myself. Hi, Zane. My name is Michelle, and I'm going to be your nurse today. Okay. So what I'm going to do is I'm going to check his wristband. Can you tell me your full name?
Zane Michael James Conrad.
Good job. And can you tell me your birthday? That one's hard. Say August 22nd, 2014.
2018.
2014. So I verified that. So then I'm going to ask him. So he already told me who he was. So then I'm going to ask him, where are you right now?
At my home.
At your home. Good. Do you know, let's see, do you know what day it is? It's
Wednesday.
Good job. And do you know why you're here right now?
Because.
Say, to be mommy's patient.
Be mommy's patient.
Good job. So he is orientated times 4. He's able to tell me all that. What I'm going to do next, buddy, is I'm going to just check your eyes. So I'm going to have you look straight ahead here and just look straight ahead at me, and you're going to see the light come out. So look straight ahead. Good job. So what I'm checking to see is how his eyes are constricting. Okay, perfect. What I'm going to have you do now is I'm going to have you follow my pen. Keep your head straight with your eyes. Ready? Follow my pen with your eyes. Good job. Now we're going to go in. And so he passes the accommodation. His pupils are the round, they're reactive, they're the same size, and they're accommodating, and he's able to locate as well. What I'm going to do next is I'm going to ask him why he's here today. I could obviously start with that. So why are you here today? What hurts today?
My tummy.
Your tummy hurts. Oh no. Have you gone poop today?
Yeah.
Yes. So we know it's not that. Have you eaten anything different?
Yeah.
Yeah. What did you eat that was different?
Orange.
You ate an orange. Okay, so you've never had an orange before, huh? So we really need to up our fruit intake here. So he ate something different, so I know maybe that could be the problem. But I know that when I'm doing my abdominal assessment, then I need to focus on that. So what I'm going to do is I'm going to just visually look. Next, I'm just going to continue on with my neuro. So what I'm going to have him do is, okay, buddy, so we're going to keep your hands like that. I'm going to have you push up with your hands. Push up. Note with your hands. There we go. Okay, keep them the same. Now push down. Good job. Okay, I'm going to have you grab my hands, pull towards you. Note with your hands. There we go. Now pull towards, push towards me. Nope, the other way. Good job. Okay, we're going to do your feet here. Push up with your feet. Good job. Now push down with your toes. Good job. Okay, push. Okay, now pull. Good job. So since I'm down here, I'm right away just going to look at his legs, check to see if there's any edema. I'm going to look, inspect. I can also start doing my lower pulses as well since I'm already down here. So I'm going to feel for that popliteal if I can. And I can feel, then we're going to do the posterior tibial. There we go. In the pedius doralis. And then I can also do cap refill as well. And if I feel like I need to, I can also do some more reflexes. But I'm going to do that while he's sitting up as well. So I just take a look at that. You can sit like that, bud. I'm just going to lay your head a little bit flat here. And did you just go to the bathroom before you came in here?
Yeah.
Yeah, perfect. So since I have him laying down, I'm going to right away do his stomach. So I'm going to visually inspect it. I'm going to look to see if there's any scars, bumps, anything like that. I don't notice anything right away.
I do have bumps.
You don't have bumps right now. So I'm going to look at that, and then next what I'm going to do is I'm going to auscultate. I'm going to listen to his stomach. So just like we did, buddy. So what I'm going to do is I'm going to listen to all 4 quadrants in 3 areas real quick. So 1, 2. So he's got 4 quadrants, and I'm going to listen in 3 spots on each one. And I'm going to listen until I hear bowel sounds. I'm going to listen for about 30 seconds in each. If I don't hear any bowel sounds, of course, you go for the full 5 minutes, and you want to make sure you're getting good, adequate sounds. I'm also at this time going to listen for vascular sounds. So I'm going to turn into my bell and listen for his aortic, his renal, and iliac. I don't hear any irregular vascular sounds or abnormal, so I can continue on. Next, what I'm going to do is I'm just going to palpate and just feel. Do you have any tenderness when I do that, buddy? Just light palpate. Yeah, it hurts. Where does it hurt?
Right here.
Right there on your belly. So he says it hurts right there in his belly, so that's something I can note to the doctor later on, or we can do further examination. We're not going to percuss according to that, but I would also look for ascites. Just make sure there's nothing like that. Yeah, you can put your hand down. So I'm going to look for ascites. I don't notice anything. Oh, hold on one second. Okay, sorry. I thought my husband was coming home, so I didn't want him to interrupt. Okay, so what we're going to be doing next is I'm going to be listening to, we're going to sit up a little bit again here. Since we're done with that, I'm going to have you just, there we go, lean like that. Can you sit up a little bit higher? That way we're at a 40-degree angle, and what I'm going to have him do right away is just kind of turn his head that way, and I'm just going to visually inspect his jugular. Nope, just like that, buddy. Here, turn your head. There you go, just like that. I'm going to visually inspect and see if there's anything abnormal. If I feel like it's really breaching, then I can do the full assessment and measure it. But visually, he looks fine. There you go. Just go straight. Okay. Next, what I'm going to do is I'm going to listen to his heart. So I'm going to listen to your heart, buddy. So we have his aortic, pulmonic, Erb's point, then his tricuspid, and then his mitral point. We have S1 down here. We have S2 up here. So I'm going to be first visually inspecting his chest, seeing how it moves, seeing if I can visually see a pulse at this point. I can't. Since I'm also listening, I'm also going to listen to his carotid as I'm going there, and then I can finish my pulse points at this time as well. So first I'm going to, just lay down, buddy. There you go. I'm going to listen, and I'll listen to his carotid first. So I'm going to listen on the one side, and then I'm listening on the other side. And at this point, I can also compare with his radial to make sure that they're the same. And now that I know that I'm also holding his radial, I can tell if it's regular, irregular at this point, and I can also measure. And then I can finish my pulses. So we have his brachial. Some will have the temporal. We did the carotid, and I'm always checking bilaterally to make sure that they are the same. So like I said, we have the brachial, then his brachial, radial, ulnar, not really too big deal, and then his femoral, if it's appropriate. Most of the time, it's not really necessary because you can do the rest. Then I'm going to be finishing up listening to his heart. So I'm just going to listen to your heart, buddy, okay? Remember to stay nice and still. You can just lay your hand. So like I said, this is his aortic. And you're just going to be listening for the sounds. You're going to be listening for regularity. You're going to be listening for any irregular sounds, any abnormal sounds. Sounds good. Erb's point, tricuspid, and then of course we have his mitral. And this is where you're going to hear that S1. Everything sounds good. Next, I can also palpate just to see if I feel any lumps. And like I said, if I feel, if I can actually feel his pulse on his chest, then at this point is also when I can do the capillary refill. And he's under 3 seconds, so you're doing good. Next, what I can do is I can have him sit up. Can you sit up for me, buddy? Perfect. I'm going to have you kind of turn. I'm going to have you actually kind of turn this way. I know it's kind of different. Can you sit cross-legged for me? Sit cross-legged, buddy. Cross-legged. There you go. Crisscross applesauce. There we go. Just so they can see. Okay. So what I'm going to be doing is first I'm going to do his respiratory, and I'm just going to have it do the back, and then I'll switch to the front. So I'm going to visually inspect. Of course, I'd normally be standing next to him. I'm going to visually inspect his back, make sure everything looks fine. Does it tickle? At this point, I'm going to auscultate right away. So I'm just going to listen. So take a nice deep breath in and out. 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 And then I'm always comparing them bilaterally. And I'm having him, and I'm coaching him to take in and out. Based on his size, you can also change the number of times or places that you would do. I didn't hear any adventitious sounds, But if I did, I can always further experiment and further go on, which I'll show in just a little. No, but don't stick your tongue out. Okay, so what we're going to do next then is, hold on, nope, stay like that. Okay, so I'm going to check for his extrusion. So I'm going to have you take a nice deep, or his chest expansion. Okay, ready? Take a nice deep breath in, out. So I did notice that my thumbs moved equally. It wasn't very much because he didn't take a very deep breath, but you can see it visually as it goes in and out. Next, what I'm going to do, okay, bud, I'm going to percuss. So I'm going to hear resonance, and if I'm going to hear dullness over the spots that I should be. Again, you're going to compare bilaterally. And if I feel like I'm hearing dullness, I can always go on to next. So say 99. 99. 99. 99. 99. Perfect. If I feel like I hear adventitious sounds in this one, I can also go further on again too. Can you say E for me?
E for me.
No, say E.
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 And again, I should be checking bilaterally each time, so I would be doing that. So then I kind of cleared that, but if I heard, I would hear like A. Okay, so if you want to turn around, buddy, we're going to do your front. Okay. Nope, you can sit up still for me. So what I'm going to do is I'm going to, again, visually inspect him. So sit up nice and straight. There we go. So what I'm going to do is I visually see, I'm going to see how his chest moves, how when he breathes, if he's using any accessory muscles or anything like that. Hold on, buddy. Don't be goofy. Okay. So what I'm going to do first is I'm going to oscillate again. Okay, buddy, I'm going to listen to your lungs here. Hey, look what I'm doing. Hey, take a nice deep breath in, out, 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 in, out. One more time, buddy. In, out. So I'm listening just to compare both sides again. Afterwards, I can also percuss, and I would hear resonance, and of course, along his breastbone, you're going to hear dullness because you're going to be on there. Come on, bud. Okay, so next what I'm going to do is I'm going to have him sit kind of on the edge of the bed, and I'll see if I can bring this a little bit closer. Okay, can you sit on the edge of the bed for me, buddy? And this is when I can also finish up my reflexes as well, because it just works a little bit easier if they're sitting on the edge of the bed. Okay. Hold on, buddy. Okay. So what I'm going to do is I'm going to check some of his reflexes. Okay, so just keep your arm nice and loose. Nice and loose, like it's dead. There we go. It's kind of hard to do this where you can see it, but so then I'm going to and I'm just looking for a little motion of his wrist. And the next I'm going to do is brachial. So just have you kind of go like that. We're going to do that again. I'm looking for his thumb to motion. Next, what I'm going to do is and I'm going to check these bilaterally, of course. Next, okay, just hang loose and ready? And his leg and his foot kicks. So that's what you want to be looking at. Was that funny?
Yeah.
And next, what we're going to do is then his Achilles. So you can just have the foot, hey, just loosen it up. Nice and loose. Nice and loose. There you go. And you can just, and then you should see a little movement of the toes. And then, oh, nobody, be careful. Okay, so next what we're going to do then is I'm going to have him lay back down. Here, bud. Okay, lay nice down again. And then we can go back to, if I feel like I have any more questions, like I should start off with, since he is a child, I should have started off with also what kind of pain. So we can use a different pain scale. So since he's a child, I'm going to use the face scale. You can't really see that, but that's my really bad attempt to draw on face scale. So I say, when you have your pain, what kind of face do you feel like you're making? Does it hurt a little bit? Or does it hurt not at all? Or does it hurt a lot where you're crying? So he's actually pointing at 0. So he says that it does hurt, but he's saying that it's making his face like that. So you can record it based off that, and you can do his observations. After that, I would make sure that he's comfortable, make sure that his parents are obviously here, and our head-to-toe assessment is done. Okay, thank you.